Good afternoon, and thanks for joining us for Ask a Legislator with Senator Ron Stollings. I'm Kelly Caseman, the Executive Director of Think Kids, and we're going to spend the next hour talking to Senator Stollings, who represents the 7th District, which includes Boone, Lincoln, Logan, and parts of Mingo and Wayne counties. We will be checking back with those of you on Facebook during the conversation, so type questions or comments in the comments section below the video, and we'll get to them as the conversation progresses. Many thanks to our volunteer who's running a little late. So I will be checking Facebook until Maddie joins us. But for those who are watching Facebook, she will be keeping an eye on your questions when she's able to join us. She actually is on break from school and is in Washington State. So we're thankful she got up early with us. Welcome, Senator Stollings.
Thank you, Kelly. Good to be on with you.
Great, thanks for being here. I'm going to share a little bit of information, a bit of biographical information from the West Virginia Legislature's website, and then ask a few questions before we dig into some more general questions. Senator Ron Stollings has been serving in the West Virginia Senate since 2006. He holds degrees from both West Virginia University and Marshall University, where he attended medical school. He is currently an internal medicine specialist in Madison and has been in the medical field for nearly 40 years. He has served in the several legislative positions over the years, such as vice chair and chair of the Senate Health Committee, and has served in other public service roles, such as on the Higher Education Policy Commission, vice chair of the Health Policy Committee of the Council of State Governments, and has received awards from the West Virginia chapter of the American Academy of Pediatrics and the West Virginia Oral Health Coalition. So let's start by asking you the same question we ask everyone we interview. How has the world, and in particular West Virginia, changed since you were a kid?
Well, when I was a kid, I would be outside playing for the most part when I wasn't in school.
How has the world, and in particular West Virginia,
8 a.m. until 10 o'clock at night. So physical activity was the rule of the day, and it was a community situation where one parent, everybody's parents was everybody else's parents, so you couldn't get in trouble too much. And but I think one of the biggest things, frankly, is, nearly the income gap wasn't nearly as bad or as wide as it is today. We were kind of poor, but it wasn't like there was real rich people and real poor people. Everybody was kind of in the middle, if you would. So I think, and I think it plays out that the rich have clearly gotten richer and the poor have unfortunately gotten poorer over the past many years. So that's a concern for me.
Yeah, I agree. And I remember back in the day where your parents just kind of kicked you out of the house and you came home when it was dark. And the world is a lot different then. So how has the health of West Virginians changed since you started practicing medicine?
Well, again, over the past several years, we've gained weight, unfortunately. And so we have a lot of weight-related issues such as diabetes, arthritis, hypertension, cardiovascular disease. And those are things that back in 2006, 2010, we were really working on. We were trying to make the built community such a way that it would be easy to exercise. You wouldn't have to go somewhere. You could simply get on the wellness trail or something like that. And use after school hours for things like that. And then as you know, this daggone substance use disorder or opioid epidemic just kind of came in and almost bulldozed everything else to the side. And I've seen that during my time as a senator the past 15 years. So I guess, we still have a lot of chronic disease, and that's largely what I do. I've been an internal medicine doctor and a geriatrician. And so we've worked on things, access to care. I think now there seems to be a little bit more access to care thanks to federally qualified health centers, rural health clinics, and things like that. Back in the old days of Bob Delisandri and Charlie McCowan, the deans of our med school, and the folks at the osteopathic school, we really were trying to talk about rural healthcare. And so I think we've focused on that, and we've done a fairly good job. Again, thanks to the federal system of cost-based reimbursement and things like that. So access to care, I think, is a little better now. We've worked on transportation issues, which were big issues in rural areas. So there's a little bit better transportation infrastructure so that people can actually get to the doctor.
Right, that's a good segue into my next question, because I remember, back when I started advocating for kids' health, maybe, around 2005, our focus was obesity, nutrition, physical activity, tobacco prevention, and managing chronic diseases like asthma and diabetes. And, back then we would have different coalitions or groups that worked on these issues. They would write strategic plans and create these coalitions, and we would work on them collectively. And it seems a lot of that work is no longer happening. And at the same time, you have this drug epidemic that is kind of sucking the life and resources out of a lot of the people and the funding that used to go towards these issues which, we do have better access, but as you know, haven't gone away. So is there a way, I know this is a loaded question, is there a way that we can, look at policy and kind of turn the way or better address some of these prevention issues?
Yeah, when I mentioned, I guess, better access to care, I was thinking about primary care. Some of the things that are needed right now, such as recovery services and things like that, we clearly have a void, particularly in rural areas. So, again, I think it's strategic. Looking at trying to turn the spigot off, if you would, on the opioids. So we doctors are much more conservative now in prescribing opioids. We know that the risks are high. The benefit sometimes is not as great. So patient selection is crucial. But we have to do this in a careful way. We don't want to start opioid naive patients on opioids like we used to, just because we know they're more risky. At the same time, we can't be afraid of treating patients in pain, because that's a real issue. And then what do you do with the people in the pipeline that's been taking, pain medicines for, 10, 30 years? You can't just stop them. And unfortunately, that's what we did. We did not have a fine tuning knob in the legislature. So we really went after the so-called pill mills and things like that. And what we did in effect was increase the use of heroin in a dramatic fashion, in my mind. And that led to a lot of overdose deaths. So again, the legislature and society needs to kind of have a fine tuning knob, if you would. And we have to invest in quick response teams, full array of recovery services, because we lead the nation in neonatal abstinence syndrome. And again, if we can invest in these kids, these at-risk kids, if you would, at an early age, you get a return on investment. And if we don't, one, shame on us, and two, we're not going to have enough money in the out years to handle this. So I know we're going to maybe talk a little bit more about grand families and foster care and things like that, but we really, really need ongoing study, listen to the experts, and really beef up this whole early childhood system. And this pandemic, on top of the substance use disorder, this pandemic is just, pouring gasoline on the fire. So there's so many things, trauma-informed care in schools. There has to be ongoing training for our teachers. We passed a bill not long ago that would allow for wraparound services, but Kelly, as you know, there's just, the workforce is just not there. We've not valued our social workers, our counselors, and now we're having to play catch up as far as getting a workforce out there, a trained workforce that knows how to deal with these kids that have all these adverse childhood experiences.
I 100% agree with you, and I think that you're right. The epidemic has shined a really harsh light on kind of the support network that we have in our state for kids. But you said something earlier that I think is important to this conversation, and that's, we kind of have the have and the have-nots, and we have a number of haves who are legislators who don't necessarily understand the nuances and complexity of how the drug crisis is affecting kids and families on that very, fundamental level. And so they need those resources that just aren't there. And so it's the same problem that we've had for years, but now it's grown exponentially.
I agree. I kind of joke around. I said, a lot of my colleagues don't see poor people. I see poor people every day, that have been poor all their lives, but have somehow been resilient and made it. But and it's been tough to get some of our bills through that deal with just what we're talking about. And sometimes I think and fear that we're heading about 180 degrees away from where we need to be.
Agree. So let me ask the next question, because it fits well into what you're talking about. So Think Kids, we've been working on a project in the 6-county area. It's funded by the Greater Kanawha Valley Foundation, and includes Boone County, your home county, to respond to the unmet needs of kids affected by the drug crisis. And so this group, we're in year 2 of the project, and the group has identified 5 top priorities to address these needs, because I think we sometimes feel so helpless that it's so, vast and problematic. What first steps do you take to address needs? And so the group came up with 5 priorities. And so off the cuff, what are your thoughts on these? And importantly, do you see these as issues that can be addressed at the legislative level, or are they more local level and community issues? So we'll start with number 1, and it's something that you had mentioned earlier. We need to collaborate and assess to meet kids' needs as they transition back to a post-pandemic world. So, I think that some people think that COVID is over, which we know that it certainly is not. Kids are going to go back to school. The question now is, do kids mask? Do they not mask? What is that going to look like? But we need to collaborate between systems to ensure kids' needs are met, physical, mental, and social health care needs, as they transition back to school. So we need coordination and a plan.
First of all, I agree 100% with your 5 areas in this reintegration back into the whatever the new normal is going to be is crucial. But I want to address something that you mentioned. And again, if we can't reach a vaccination rate of 70%, which is the definition of herd immunity, we're not going to be able to get back to normal. We're going to be having ongoing problems with the various variants that are bigger, meaner, harder to kill, and at some point is going to skip away from being vaccine preventable. Just a mutation or 2 will do that. So I've been trying hard to get people vaccinated. I speak with them every day. So we're not going to be able to reintegrate and get back to some form of normal. And again, I guess you may have heard that the Academy of Pediatrics, which is the largest group of pediatricians, organized pediatricians in the country, are now saying that probably the kids need the mask, all kids. So, and that's a shame, because if we could have, if we were as successful as we were in the first 3 or 4 months of getting people vaccinated, if that had continued and we were up there to nearly 70% instead of just over 50%, then I think the mask would not have to be done. I don't think the Academy of Pediatricians would be saying that. So, but as you know, there is a a plan, a federal plan that talks about rebuilding the public sector and investing in social infrastructure and the care economy, which is crucial, I think. I think this, the plan that they're working on a federal level that deals with traditional infrastructure, but also family and health and public health infrastructure. These are all things very critical. And we are at a point in our time in West Virginia at this, if we use those dollars the best possible way, investing in early childhood, investing in all the things that we talked about, education, then I think we can land on our feet. But I worry that, there's people not for the social infrastructure aspect of this and not realizing just how important that is. So I hope that we can, one, pass it in Congress, get it out here, and then we as leaders really need to listen to the experts and see where we can best use this federal money. Because I think that's, we have an opportunity, but it's a one-time opportunity, and it's now. And if our leaders are saying, oh, we don't need that, or we're just going to deal with bridges and water lines or something like that, we're going to lose it and we're going to be in trouble.
I agree. I mean, if we just made an investment in kids, kids can be really resilient, right? But they need to be safe and healthy as they're growing up to, get to a place where they can make some decisions on their own and take some opportunities for them. But they need to get to that place. And I agree. I think that that funding could be very helpful to them. And so back to the point. So you think that more collaboration on the community level, and then you try and utilize and advocate for that federal funding to come down to help with a coordinated approach.
Yeah, absolutely. I think the coordinated use of those funds in the best way possible. And the best way possible is what organizations like Think Kids, Kids Count, the education, preschool experts, they know how we can best use this. And then the other thing is, when we talk, our demographic, our only growing demographic in West Virginia is our geriatric population. And so, and as you know, then a lot of our geriatric population is now caring for a generation or two younger than them. They've raised their kids. Now they're raising their kids' kids, and in some cases, their kids' kids' kids. And right. And we need to support those, the seniors, from a technological standpoint, the aspect of someone 80 years old trying to deal with someone, a toddler or something, or school age kids. We got to give them some support. We got to amp them up, because in many cases, as you know, they're the only ones there that can care for those kids. And then we have to support, the carers, the caregivers is a huge thing. And I see that, I'm not a pediatrician, I'm more of a geriatrician. So I'm on the other end, but supporting our families, because caring for someone, one, it takes you out of the workforce. And two, it stresses you out. And if there's stress in the family, there's stress in all aspects of the family, including children. So there's more adverse childhood experiences. And so the more we can do for the family unit, and again, I think with some funding is going to be crucial, because again, if we can't educate a population, if education's out, then everything's out. So the education aspect is just absolutely crucial.
So that's one of our 5. So let's jump to that one, because I'm sure you've heard of the Healthy Grand Families program, and they do wonderful things. I think that building it and it growing to all 55 counties was a wonderful decision that the legislature has made. But we need to do more to ensure that grandparents have the financial and systemic support. And we know that we have a number of kids who are staying with grandfamilies or their grandparents who aren't receiving financial support because it's not kind of become this official, they've not gone through the official process of being, say, a foster care provider. And so we talk to families who, you know, grandma and grandpa stop, say, getting their medicine or going to the doctor because they don't have the income because they're having to pay for their grandkids. So how can we address that? Is it a first step of education of legislators to convince them to perhaps take on this issue? Is it more of a federal problem that needs addressed?
I think it's multi-level. I think it's federal. I think just like the idea of providing funding for caregiving for folks, elderly patients who have some dementia or something. We know that aging in place is much more cost effective than having someone institutionalized, and no one wants institutionalized. So we could use that formula, if you would, also as far as caring for foster, well, grandfamilies are not, they are kind of foster kids in a way, but it's the family caring, which is as ideal as it can be. If you can't have your mom and dad, then having an aunt or uncle or grandparent is the very next best thing. But we need to support them, and we don't support them near as well. And so there has to be ongoing looks at the DHHR and the foster care system and tweak it and find where you can, the best return on investment is. And it has to look long-term. So we have to look at places that have done well with this, and West Virginia, we can do well with it too, because we know that this investment is so crucial. Because if a kid is not on a reading level at a certain age, we know what that predicts. Right. And so we know all these predictors, and these predictors, if we don't fix it, the cost in the out years is just insurmountable. So we can't, in incarceration costs and things like that. So the way I see it is you spend a little bit upfront with high touch, low tech, and usually that's less expensive than using things down the road that is low touch and high tech and much more costly. So I think we really need to spend our money early in order to prevent. And so ongoing studies, ongoing data, I think data is pretty important so that, we can make these decisions, and future legislators can make these decisions by knowing that, look, we did a pilot program. This is what we found. Let's spread this out, kind of like the healthy grandfamilies, and really improve all this to where it's very efficient and cost efficient. Because, but it's so hard for legislators that I've seen to look down the road. In many cases, the focus is not on strategic spending, but cutting taxes. And we've already, cut taxes, and we know that the people that benefit from cutting taxes are people that are wealthy, typically. And so we need to really look at where we can strategically spend money in order to save money down the road.
Right. Well, of course, I completely agree with you. And I think that something that comes up in a number of conversations that we have to be mindful of is, thank God for this older generation that's willing to take in these kids, but there's a good chance that the next generation will not be able to if we don't do something about this drug crisis now. And so we've really relied on this generation, and giving back to them any way we can is an important step. So moving on to something that we discussed a little earlier when we asked you about being a kid. We've heard from a number of folks saying that there's not enough things for kids to do in communities. And when there is organized programs such as sports or camp. I was talking to somebody yesterday that, statewide 4-H camp, for example, costs around $400. Families can't afford or they don't know about these programs. So we need to focus more on engaging activities on the community level for kids to do that build that supportive relationship. So as you said, more touch, less tech. So more supportive relationships with adults and can also in the meantime stop them from participating in risky behaviors.
Yeah, absolutely. After school programs, summer school, also I can't help but think of food. We might talk about food insecurity later, but these organized activities, and again, I was an athlete, so I was playing basketball or football. When I wasn't doing that, I was playing touch football or something around. I lived close to Scott High School, so I used that. Not everybody has that in their backyard. So, and it can be one kid at a time, but we have to engage mentors, role models, service clubs, and unfortunately, Kelly, and this is so bad, I hate to say it, but sometimes these kids can be taken advantage of. Unfortunately, we have a lot of abuse in families, so there has to be a safe area. Certainly, school-based programs, I think, have the biggest bang for the buck. The faith-based church type activities, and so I know here in Madison, we've had a Rotary program where we're going to do some after-school things for kids. With Ms. Williams, who's a teacher, and yoga, things like that you don't have to be an athlete to take full advantage of. But and again, being around people that are positive role models, people that are not smoking, people that are not drinking, or loud and abrasive, but people who obviously care. And it would give the adults a sense of purpose if they would participate in that. I think of scouting. I know scouting's got a black eye lately, but there's still organized activities, little leagues, and we should focus on things like that. And our river recreation, these kids like to float down these rivers, and we have all this natural beauty and habitat, the woods. I used to love being in the woods and along the river. So we have to take advantage of our natural resources that we have, but we need mentors and role models out there.
I agree. So Marshall University, Dr. Todd Davies has some CDC funding to work on building up mentorships and the kind of training that mentors need to go through. So I'm really excited about that, and I'm excited about the expansion of the ICE model. So I'm sure you've heard of Dr. Alfgeir Christensen and what they're doing to support programs that keep kids from those important hours after school to dinner engaged and participating, especially in Fayette County, in recreational activity that is with, again, great mentors is really important. And I think that we also have a problem with people just not knowing where good programs are that don't cost money, and where they can go to get that information. So that's something that we'll be looking at as well. Moving on, we need a pantry and hygiene closet in every school. Some schools have them, some don't. How can we ensure and sustain them in every school?
Well, food insecurity is huge. Hygiene issues are a big problem as well. And we know that many times education outcomes are based on what happens from 3 p.m. to 7 a.m., as opposed to what happens from 7:30 to 3. You could be the best classroom teacher in the world, and you may not have a good education outcome if that unfortunate child goes into a place of where he's not being cared for and maybe even being abused. So at the very basics, someone needs to be able to be clean and someone needs to be able to eat. So those are the basics. society needs to do that. If we can't prop up the family itself, then they need to be available to the school system. That could be anything from, you know, a lot of these places have backpack buddies. I contribute these food pantries. I'm just amazed at all the great work that's going on in West Virginia, and you know, through the churches, through scouting, through Rotary clubs, Lion clubs, and individual people. So that's something that we just need to support. If we need to amp it up via any type of SNAP benefit expansion or something like that, that's what we need to do.
I agree. And most of the pantries and hygiene closets that we do have in the state are funded by churches, Rotary clubs, Lions clubs. I think one of the biggest problems that we have is, you know, we have these deserts around the state where there just aren't these robust programs that can support them. And they're also the type of places around the state where there aren't supports, right? There aren't social supports that can keep it up and running. And so it's become very difficult for us to identify where those places are in order to ensure that they get the resources that they need.
I'm guessing that'll be an ongoing problem. And again, I suppose that if you lay over those deserts in West Virginia, that would light up kind of poor in similar areas, such as internet availability or all these things that you know, we have to somehow figure out a way to level the playing field for these kids to be able to compete and to learn and become productive members of society.
Very true. So this last suggestion from the team working on this project kind of encapsulates all of these. We need a cabinet position in the governor's office to address children's health and well-being and ensure that all government systems and bureaus that work on these layers of issues are synchronizing their efforts. Governor Caperton had a similar office. In this moment of the drug crisis, we need systems to work efficiently together.
We do indeed. We also need a real drug czar, you know, in the same cabinet that can help coordinate all our services and find out where we're weak in certain areas, and whether it's geographically or whether it's the service that we provide. And so I look at those kind of as, you know, two different people, but two very important people in the governor's office. In fact, my platform called for that. I did run for governor, and my platform called for just what you're talking about here, as far as you know, trying to de-silo a lot of the things that have to do with children and family.
I remember that and was excited about that. And I think that it would be really helpful in breaking down those silos, like you said, because I think that the powers that be that are now in the legislature may have concerns about another layer of government spending. But I think that if we started looking at how different systems are addressing the drug crisis, you would see a lot of overlap. And so it would maybe be more efficient if they were collaborating to address those needs. But we'll see how we fare with that issue on the project. So I'm not seeing any questions on Facebook. So I'm going to move on to the next question. You had mentioned food insecurity a number of times. And this is something that we discussed in another project. And the Health and Hunger Project most recently had been working in your neck of the woods in Boone, Lincoln, and Logan. Over the years, we've heard more discussion at the legislature about social determinants of health. Food insecurity has been a significant challenge across the country during the pandemic, and certainly here in West Virginia. But what we found is it's not necessarily the lack of food, but the infrastructure to get the food to where it needs to go. The House has created a food insecurity work group to study the project, or to study the problem rather. What are your thoughts on better addressing hunger and creating a state infrastructure to do it?
Well, I think this pandemic has certainly shone lights on lots of things. That it's been tough for accessing food, even if you had a Kroger's nearby or a Foodland or something. So, valuing our frontline workers, of course, is something that we, I think, have done and continue to need to do. But, I think back of my grandfather who helped raise me, had a big garden. And, I learned how to grow things. So being in the garden was great. This pandemic, I think, has allowed us to do a reset, if you would, and think about freshly grown vegetables, extend the growing season with these hot houses and things like that. We've tried to expand the access to farmers markets and things like that, community gardens. This past year, I think we were able to pass a bill, shared table, so leftovers can go home from either a senior center or from a school to kids that obviously have unmet needs. And again, we have to use our federal funding, some of this social infrastructure to make sure, again, that, food, clothing, and shelter. I mean, it doesn't get any more basic than that. And a society that's not providing for that is not a good society. And so we absolutely have to look at innovative ways. And I think part of it is it's catching on. Again, these greenhouses that, West Virginia has a fairly short growing season. We all love our fresh tomatoes in July and August, and then other times then you can't get good fresh tomatoes or whatever. So I think expanding the growing season, I think future farmers of America and schools, and everything tends to be school-based. And so I know that, there's good things going on in schools in my district that deal with this. Teaching kids how to grow their own food and things like that.
I agree. And I just found some questions online that I'll share with you in a minute. But when we worked on the Health and Hunger Project a few months ago, what you were just saying about gardening, the WVU Extension has seen more interest in online gardening classes. And there seems to be more people who are interested. And when we start talking about food deserts around the state, what a wonderful way to try and address it. And then they also started providing online canning courses. And so you could enjoy it all year long. And so I think that, there are no benefits of the pandemic, but at least we had, people using ingenuity to address those issues. So I'm going to share a couple of comments that we've seen online. Cindy Chamberlain is somebody that we work with often, and her focus is on neonatal abstinence syndrome. And she thanks you for your comment and says, acknowledges what you said about the drug epidemic not going away in just a few years, and that the problem will take more than a generation and is going to take longer than that to resolve. So she's grateful for you for realizing that. Helen responded that United Way's 211 is a wonderful resource to help families and to learn about opportunities in our communities. Do you work with 211 at all?
I'm aware of it. Haven't used it. That's a resource that we probably take much better advantage of. Yeah.
Yeah, I didn't use it much either until the pandemic started, but since over the last year, they have partnered with a program you may have heard of called Big Bertha, and it helps connect the healthcare system with the social support system. So it interfaces with electronic health records. So if you had a care coordinator who, if you identified a patient as food insecure, it could help them find the nearest location of a pantry. And so that's really exciting innovation happening as well. And then Christina Mickey asks, Senator, what does West Virginia need to address the epidemic of West Virginia kids using e-cigarettes?
Well, that's certainly something that Senator Takubo and I have tried hard to do. You know, we'd probably just ban it. I mean, we were working on tobacco 21 legislation for years, each time getting shot down. But now the federal is now T21. So you can't buy these products until you're 21 years old. And we know that the brain isn't developed enough to make good decisions, at least until you're 25 or so. So putting off, and we also know that if you wait longer to use something potentially addictive, the less apt you are to be addicted. So those are all things that we should be doing. And unfortunately, it's just been a huge sigmoid curve of teen vape use. And again, it's got to be an education attempt anyway, that these things are not innocuous, that they can cause popcorn lung and really, really bad lung disease. So it needs to be an all hands on deck, from the primary care doctor educating the Academy of the Pediatric people, the school-based, and then, peer to peer, support for not doing it or shaming for doing it. It's a tough situation, and we need to go after it because it's deadly.
It is. I feel as if we actually started making a dent in, early tobacco use in West Virginia, and then here come your e-cigarettes. So thanks for those who responded to questions online. Please keep them coming. And so let's go back to something you touched on earlier. 45.7% of West Virginians have had one dose of COVID. What can we do to improve our vaccination rates?
Well, I ask every patient if they've been vaccinated. And that's the first one, is ask, and then I advise them. I try to talk about the millions of people that have had, the shots, and it's a safe, effective vaccine. And I certainly have, led by example. In December, I had my vaccine. So I think the primary care doctor is a good spot to embrace and I've had several people, even lately, that have gone ahead and gotten their vaccines after having the conversation. Having the vaccine readily available would be very important, like a flu shot or something, but we don't have that. It requires them to go somewhere else or to come back on another day for that. So that's an issue. But my fear, and I've been on Hoppy and I've been preaching this, and in fact, my colleague and good friend Greg Elkins and I have done a little Facebook thing that we're trying to get people to get vaccinated. We know now that in low vaccinated populations that this variant is coming back with a vengeance. Until we get 70% or herd immunity, we're not going to be okay. Our society is not going to be okay. We're not going to get over this. And it's just frustrating to me. We ought to be just like everyone was, the first 40% or 50%, they wanted those vaccines. They went and they got them as soon as possible. They're like, Doc, when can you get me a vaccine? So I just wish we had that, maintained that. Now we're into the group of people that think it's some kind of a federal or political conspiracy, and that, they don't want to get vaccinated. And it's heartbreaking for me because I know what's going to happen. Either weeks from now or months from now. I'm so excited to be able to go to a Marshall football game or to a WVU football game. In fact, I have tickets, man. Go up and watch West Virginia and Virginia Tech play, man, renew that rivalry, knowing that it may not even be played if people don't, step up to the plate and get these vaccines. It's crucial. I've talked to, the folks, at all our higher institutions, all our med schools. So it's really important. But I'll tell you, they're pretty stubborn out there. I can't talk sense into their heads in many cases. But 30%, if they don't, the hardcore 30%, the anti-vaxxers, the anti-maskers, if we could just get the other 70%, then we could still quell this pandemic. But until we do, we're not going to quell it. It's going to come back and bite us again.
We have a couple questions online for you from Diana. Are vaccinations being considered for children under 12 years old? And if not, what is being done to address their vulnerability and the vulnerability of their families?
Yeah, I think they want further studies, I guess, on vaccine safety and efficacy in this age group. My guess is that it will be recommended on children under 12. That's my hunch. That's nothing scientific. And as I mentioned earlier, the American Academy of Pediatrics now recommend unvaccinated and vaccinated kids to wear their mask during school. And again, if we'd have reached 70%, we wouldn't be having this conversation. But unfortunately, we're at just, maybe 50% have had at least one. And again, we know the areas such as Arkansas and places that are low vaccination rates, it's just coming back with a vengeance. So I think education from the primary care doc, education at faith-based education might help some. And we just need to keep pushing. I know that several of my Senate colleagues in the minority are really pushing hard for that. And I know state medical associations having a meeting in August that a lot of the agenda deals with this very issue. So all these American Academy of Family Practice, American Academy of Pediatrics, American College of Physicians, state medical, they all are pushing this because they think it's what it's going to take to get this behind us.
I agree, and I'm going to jump back to a question that I had written that I had skipped because you had just mentioned a number of groups that are experts, and we really value their opinion. But it seems as if, especially lately in the public discourse, we have stopped listening to our public health experts, and we're kind of leaning more towards partisan politics, and how we affiliate ourselves with our political ideology dictates what we believe when it comes to, for example, COVID. And so, my parents, for example, are very conservative folks, but they're also in their 80s. So they got their COVID vaccination relatively quickly because they knew the consequences. But we, at Think Kids, we have people who contact our Facebook page relatively often who believe that mask wearing is a form of child abuse. And it doesn't seem to matter how often we say, for example, the American Academy of Pediatrics recommends it in a school setting, that kind of falls on deaf ears. So do you have any ideas on how we can build trust and come back to a place where public health becomes valued and a nonpartisan issue?
Well, Kelly, that's a heavy lift. One of the things that I remember from the AMA, American Medical Association, I still have a little pendant there from my chest that says PH, physician begins with PH, which is public health. And so I have been so disappointed in many of my colleagues that just flat out go 180 degrees from where I think most scientists would think we need to go. Some of it was even on the syringe service program, that Senate Bill 334. Senator Unger and I, a couple years ago, started the Public Health Caucus, and it was nonpartisan. Had folks from the School of Public Health down, and we talked about root causes of where West Virginia is. We don't have good health outcomes, but we also know that our poverty and lack of education and many adverse childhood experiences are the root causes. And so, when we're trying to deal with poverty, and again, I don't know how you can get people to come together in a nonpartisan way. I'm sure that I'm probably the least favored senator for the past 16 years with regard to anti-vaxxers. I mean, because a lot of the younger anti-vaxxer people, they've never seen mumps, rubella, heart disease from measles, and polio. I mean, these vaccines have absolutely been probably the biggest societal positive thing we've had, or we'd still be having people with polio and smallpox. So it's a great tool in the toolbox. We just need to use it. And again, people are saying, well, it causes autism. That's been debunked. So I don't know how you do it. I would recommend people kind of ask that question. Everybody asks a question. I mean, it's in West Virginia politics, it's about God, guns, gays, and abortion. Okay, I think people ought to ask questions like, what do you think about public health? Do you think we ought to invest in public health? What do you think about education? You think we ought to invest in education, early childhood development? Instead of, wondering where someone's going to use a bathroom, wondering who's going to run a 100-yard dash, and then spreading that, we're going to come in your house and take all your guns away from you. I mean, those are just things that, but I think people ought to be asking. I think the voters ought to be asking what you think about these things, and vote in people you think will do a good job regarding this type of thing. So education is the key. We unfortunately have not valued public health. We've cut public health. These poor people who are heroes, and working with 3 people in a county or 4 people in a county, we ought to be pouring infrastructure and funding into these health departments so that they could develop a robust response to our public health issues. And it's not just vaccinations. It's not just the opioid epidemic. It's whether there's clean water, whether the restaurants are inspected, whether there's a HIV or Hep C or Hep A outbreak. I mean, we have absolutely hamstrung public health in West Virginia, and that's clearly have gone the wrong way.
Well, we agree, and it's a concern of not just the health of future generations of kids, but even these kids now, because I think you're probably right that you're a least favorite legislator of the anti-vaxxer crowd. And I'm wondering if they're going to be gaining any kind of foothold with this anti-COVID vaccine when it comes to, future legislation that threatens our school vaccination policies.
Yeah, so there's been several anti-vaxxer legislators voted in lately. So it just gets closer and closer, where some states are trying to look like West Virginia, a strong medical exemption only state. So if you can't take a vaccine and you have a medical exemption, you don't have to do it. What the anti-vaxxers want is if you have a religious belief, or if you just have a philosophical belief, hey, I don't want to be vaccinated. And again, once we go below a certain level, then these states that have these exemptions, they have outbreaks. You've seen it. The good thing that's happened in a few cases each year is when we're in the legislature, we're discussing these anti-vaccine policies, and then you see a big outbreak come about, and mumps or whatever, these vaccine preventable diseases, and that gives us, the science believers, a little bit of ammunition. But I fully fear that in a matter of a year or two, if we continue to vote in these anti-public health people, then we're going to undo some of the best pro-vaccine, pro-public health laws in the country.
Right, I agree. And then imagine if we had an outbreak and these hamstrung health departments have to work to address it. I agree. So we only have about 5 minutes left, and we have two important questions before we end. Are there any other health or kid-related policy priorities you'd like to talk about or see organizations like Think Kids focus on?
Well, again, student homelessness. I was speaking to my good friend Stephen Baldwin, colleague, and that's a real issue. Student homelessness. There's a lot of kids out there couch surfing. They're not living under a bridge necessarily, but and it's my understanding there are upwards of maybe 9,000 to 10,000 kids in West Virginia. So, and again, those same kids are at-risk kids. They're probably they go to bed hungry sometimes. They don't have clothes. They don't have good self-confidence. They may not have access to oral health care. They're more apt. I think we need to look at, incarceration. We have to look at our juvenile detention facilities and try to really, you don't want to go from the playground, to the penitentiary yard. We don't want to do that. There's got to be more support that we can give them. I think we have to have ongoing foster care evaluation and make sure that these kids are getting really good foster care, and whatever it takes to do that. I think we have to work on our workforce. I think someone's got to study the workforce issues that we need, the counselors, the social workers, the play therapy people. So I think the workforce is something we really need to look at. And when we look at education outcomes, and that's what we're after, right? I mean, we know that health outcomes come not necessarily from the health system. Only 20% comes from the health system, but it comes from whether you got a job, whether you have an education, what your behaviors are. The same thing applies to education outcomes. So where we're spending time and effort on, charter schools and things like that, we ought to be looking at small class sizes and access to these special services that may be needed for learning disabilities and things like that. So I think workforce issues, student homelessness, and foster care has to really have a bright light, and we got to be able to figure it out.
Great, thank you. So noted. And our last question is, if we have folks watching this now or weeks from now on our YouTube channel, which it will be posted tomorrow, and they're in your district and have issues or ideas for legislation, what's the best way to contact you?
I'm listed in the book, Ron Stollings, 304-369-6194. That's my home number. And my Senate email is ron.stallings@wvsenate.gov. And that really is the best, idea I get back to people. I think people should talk to their delegates and senators and let them know what they think is important in their lives. I think that we get too far off on these social issues that we don't talk about the kitchen table type things, whether you have food, whether you can get an education, whether you can go to college. Then again, if you want to come to the Capitol and page, if you want to come to the Capitol and visit, go to Know Your State Government Day. Those are all fun things to learn about government. Study in your civics class. I've been to several classes and actually talked about how a bill becomes law and things like that.
That is great. I want to thank you so much for joining us today and entertaining and answering some pretty hard-hitting questions. We missed Maddie, but thank you anyway, Maddie, if you're still looking for a cafe to get online with us. We really appreciate the work that you do at the Legislature, Senator Stollings. And in a few minutes, we'll post links to your page on the West Virginia Legislature, as well as a link to the interim schedule. So people, if they want to pay more attention, can do that. And of course, everybody's welcome to check our YouTube channel out tomorrow, and we'll post the video there. So thanks again to you, Senator Stollings, and to those of you who have joined us. And if you have any further questions, please email us and let us know. Thanks. Have a great day.
Thank you, Kim.